My name is Raphael Gege, and this presentation is about health promotion. Health promotion is the process of making people aware of the negative impact of certain lifestyles and teaching them how to make changes if they're on the wrong track. The aim is not just to help change the wrong way of living, but also to teach them how to maintain a new lifestyle that will be introduced to them. This might be what they eat, drink, or smoke. It might be about exercising and living a healthy lifestyle. It might be about personal hygiene, mental health, handling aggression, or being resilient during difficult times. According to the World Health Organization, this is accomplished by building healthy public policies, creating supportive environments, and strengthening community action and personal skills. In this promotion, I'll identify 2 health promotion campaigns and explain how they relate to society and individuals. I will organize and plan a health promotion activity of my own. I will outline a proposed health promotion activity and design an appropriate resource that I can use for the activity. I will explain the rationale for the proposed activity in relation to health promotion theory. I will discuss how I intend to promote this area of health, the resources I will need to use, the suggested time frame for the launch and duration of the activity, and the choice of media to be used for the activity. Finally, I will discuss how to determine the effectiveness of the resource developed for the chosen health promotion activity. The first health promotion that I will be talking about is Change for Life. This health promotion is about helping and motivating people to live a healthier life by eating well and moving more. This is presently a popular and well organized brand with 97% of the mothers with children between the ages of 5 to 11 years old following the program. This campaign was launched in January 2009. It was England's first national social marketing campaign to reduce obesity. For a successful promotion, the Department of Health requested the expertise of the academic and commercial sectors, a good understanding of behavior change theory, and evidence from other successful behavior change campaigns were needed. This gave a good insight into how to manage the targeted group for the research. With the beginning changes carefully planned out, the campaign reached 99% of the targeted families. 44,466 families joined Change for Life in the first 12 months. More than 44,833 families were believed to still be involved with the program after 6 months. In the first year, over 1.9 million people responded either via posts, online, face-to-face, or telephone. In 2021, Change for Life was brought under a brand called Better Health. The reason for this was because Better Health brings together all of the NHS tips, tools, and apps in one place to help the nation make small, simple changes to quick start and improve health across a full range of activities. The main idea behind Change for Life is to create and maintain a healthy lifestyle physically and mentally. Another very important health promotion in the UK is the NHS Health Check. This program aims to prevent certain diseases such as heart disease, diabetes, kidney disease, stroke, and dementia through the early assessment, awareness, and management of individual behavioral and physiological risk factors. This helps to identify any of these diseases at an early stage so treatment can be administered and the necessary steps to recovery can be started early before any major damage is done to the individual's health. A total of 15 million people are eligible for free NHS checks in England. This program has the potential to prevent 1,600 heart attacks and strokes, 4,000 people from developing diabetes, detect 20,000 cases of diabetes or kidney disease each year, and help avoid at least 650 premature deaths each year. For those already living a healthy lifestyle, these checks give them a sense of relief when their test results come out with very low risk of developing any illness. This reassures them that living a healthy lifestyle pays off. For those with poor results, it was an awakening moment for them to start making changes to their lifestyle. either by quitting bad habits such as alcohol and smoking, or to start exercising and eating healthily, based on advice given by health care professionals. Why Change for Life is more about obesity and making positive changes to improve one's health with exercise and a healthy diet. NHS Health Check is more about carrying out a thorough, intensive health checks on an individual with the intention of spotting any symptoms that might lead to certain diseases, or if the disease is fully developed. Advice and support received from NHS help these individuals to make life-changing health decisions. In summary, preventing these diseases from escalating does not only reduce expenses on society, but also significantly reduces the burden on the NHS. This works perfectly in the interest of both the society and individual. The campaign I'll be promoting is called Yes to Mental Health. The reason I chose to promote this campaign is one of the reasons I applied to study mental health nursing. Working presently as a mental health care assistant, I strongly believe that the importance of a stable mental health cannot be overemphasized. The World Health Organization acknowledged that in 2019, 1 in every 8 people in the world was living with a mental disorder. This was approximately 970 million around the world. Mental disorders affect how people think, how they regulate their emotions and behavior. Mental health conditions can lead to psychological disabilities, impairment in functioning, or risk of self-harm. Some of these disorders are depression, bipolar disorder, post-traumatic stress disorder, dementia, schizophrenia, and autism. The World Health Organization has also acknowledged that a lot of people with these conditions do not have access to effective care. The idea behind this campaign is to bring more awareness to people of all ages and ethnic groups. The reason I lay emphasis on ethnic groups is because some cultures are not keen on addressing such topics. It is regarded as a shameful state, and this is due to lack of adequate knowledge on the topic. I intend to promote this campaign by reaching out to all ages and ethnic groups by handing out and posting leaflets and posters about the campaign at public places such as schools, NHS facilities, community centers, off-license shops, and supermarkets. I will also be using different social media platforms and mass media. To begin with, I will create a website for this promotion. I will create an official page on different social media platforms such as Facebook, Instagram, YouTube, and TikTok. I will also make use of TV and radio channels that will refer people to the official website and social media pages. This will make the program accessible to every age and ethnic group. A Yes Mental Health app will also be created. The app will be used to keep track of those that registered and are following the help program, and the results of the impact of the program in their lives, whether positive or negative. I will need mental health professionals, school teachers, and even police officers. The idea is to get these professionals to make short videos of themselves, giving advice and tips on how to identify mental health conditions and how to seek help. The reason I need the police videos because many people in the world today are suffering from mental health conditions that make them violent. Some of these people end up having problems with the law, not knowing there's treatment out there that can help their mental states. I need a video from a teacher explaining to students that there's help for those dealing with depression and being bullied in schools. Bullying can affect the mental and physical health of children during their early school years and into adulthood, in some cases even death. The reason I need a mental health doctor or nurse to make a video is to help reduce the stigma behind mental health illnesses. These videos are meant to reassure people that there are available treatments and there's nothing to be scared of or worried about. The created app will direct an individual to any of these listed organizations. This depends on the answers given during the application phase. It might also advise a visit to the GP. Some of the organizations are Talk to Samaritans, Short Crisis Text Line, Rethink Mental Illness, Mind Organization, Calm Helpline and Web Chat. Tell someone you can trust, and Specialist Mental Health Services. These organizations are equipped to advise on different mental health conditions. People can call for help on how to cope with their mental state. According to the Mind Organization, 1 in 5 people have suicidal thoughts, and 1 in 15 people attempt suicide. This promotion will help This promotion will bring help to their doorsteps and let them know that help is just a phone call away. The suggested time frame to launch the campaign will be 6 to 12 months. The reason for this is because of the number of videos that need to be made, the number of interviews that will be carried out, and the development of the app, website, and database. Most of the professionals needed for this promotion are known to have very busy schedules. This has to be put into consideration. In relation to this health promotion theory, the rationale for years to mental health will be from the perspective of the ecological model. The core premise of this model is to look at the different behaviors on various levels, such as individual level. At the individual level, it will be looked at how it directly affects the person that needs mental health assistance. This will be based on age, gender, health status, and belief. Interpersonal level. At this level, it will be looked at how those following the program influence others around them and how others influence them. This could be family members or friends. Institutional/organizational level. Schools and offices are part of the organizational level. Their role in any healthy promotion is very important. They play a major role in the implementation of the program. Community level. At this level, the relationships between the organizations, their cultural norms, and values are put into consideration. Public policy level. At this level, laws, regulations, and society level factors are implemented. In a promotion like Yes to Mental Health, GDPR laws for data protection must be adhered to due to the amount of data analysis that will be taking place throughout this promotion. For the evaluation plan, I will put in the following into consideration. Stakeholders, the aim of the evaluation plan, identifying important questions, finding resources for the assessment. I believe that Yes to Mental Health will make positive changes in certain people's lives because of the way it is presented and the ease with which people can get the help they need. To be able to keep track of how well or poorly the program has impacted people, an evaluation needs to take place. This will provide data to show that the right individuals are targeted and how they are progressing. The aim of this evaluation is to make sure the funds given for the promotion are utilized properly and it yields positive results. In the case of the stakeholders, I'll be reporting and giving updates to the Office for Health Improvement and Disparities. This office is normally in charge of health promotion in the UK. Some of the important questions that need answers are: will Yes to Mental Health's approach to the general public be effective? The second question is, will the data collection technique be good enough for the promotion? Data collection is very important for analytics and referencing in the future. Resources that will be used to gather data for this program will be mainly through the app. The app will have tabs. One tab will be to accept the use of the app and get connected to one of the mental health organizations that best suits the individual's mental state, after answering yes or no to some questions. Another tab will be solely to keep track of the individual's progress. To get this information, these individuals will have to state how well the program is impacting their lives by selecting poor good, or excellent to the questions asked. The third tab will provide data about the opinions the opinions of these individuals when and if they complete whatever program these organizations have lined out for them to help with their mental health issues. These organizations will have access to a form on Yes Mental Health's website where they can fill in updates about the individuals. The accumulated data will be stored in a Microsoft SQL database and will solely be used for data analytics. This will be done either by writing T-SQL scripts to retrieve specific data for the stakeholders, or to create reports using visualization tools like SSRS or Power BI that can be viewed online anytime. As for the front end, such as apps and websites, an expert will be hired. I'm a certified Microsoft SQL database developer. I will play a major role in all backend activities from development to data analytics. I believe Yes to Mental Health will be a success because of how easy it is to reach out to everyone and help solve mental health problems that many do not even know they have, and a discreet way they can get help for their problems. Thanks for watching.